Good morning, everyone, and welcome to Vegan with Jen. This episode is all about rheumatoid arthritis and plant-based diets. So who better to have on Skype with us than Dr. Monica Aggarwal? Dr. Aggarwal is an author, assistant professor of medicine, a researcher, the director of Integrative Cardiology and Prevention at the University of Florida, and the director of medical education for cardiology. In the hospital, she is developing an 100% plant-based menu for cardiac and vascular patients. She is a member of the Nutrition Council working on nutrition policies for the nation. She specializes in preventative management of heart disease with lifestyle techniques together with medications. But today, she is here with us to share her story, her personal experiences with rheumatoid arthritis and plant-based diets, giving us a fresh perspective on how much of an impact diet can have on your health. It's such a pleasure to have you on my channel, Dr. Aggarwal. Thank you so much for being here.
Oh, it's my pleasure to be here. Thanks so much.
I think your story is so important to share. I'm honored to be sharing it on my channel. So to start us off, would you like to share an account of when you first found out you had rheumatoid arthritis?
Sure. So now I have 3 children, and my youngest is now 7, and so that'll give you a sense of when this all started, because I developed my first symptoms of joint discomfort about 4 months after I delivered my 3rd child.
Okay.
And it started out, I was always an active person. I was a runner. I was vegetarian. I was a full-time cardiologist. I had 2 small kids already, a 2-year-old and a 4-year-old, and then had this new baby girl. And so it was a bit of a complicated time, but I was always very healthy and still running through my pregnancy, and really pretty much right after pregnancy I was as well. I mean, you could argue that I was a bit crazy at the time, or maybe still am, maybe, I don't know. And so 4 months after I delivered, I started developing pain in my fingers. It was just 1 or 2 joints at first, and it would migrate. So I'd have it for a few days, it'd get red and hot and swollen, and then it would move to another joint. So I figured that I had just hurt myself along the way because I am super active, and I just must have been hurting myself. And so, but over a couple-week period, it went from being multiple issues. I started feeling that, when people describe this, when I've heard people describe it, I didn't really understand until I went through it myself. But when every time I'd get out of bed, I felt like there was ice or glass, like cutting my feet. So, I changed my shoes 3 times. Because I could never accept that the problem was me, but it was rather that my shoes were a problem.
Right.
So I changed my shoes 3 times. I kept buying new shoes, thinking I just needed to get better shoes. But slowly and slowly over a couple-week period, I went from being this very active person to being almost completely immobile. Wow. So arms, fingers. I remember feeling that there was something wrong with baby clothes, because why would they make snaps? Because I couldn't snap the clothes, the baby clothes together, and I couldn't understand why people would make snaps because they're too hard to clasp. So these sort of funny things about yourself you look and reflect back on always make you laugh, but that's sort of how I felt, and I just couldn't accept that I was sick. I always sort of tell people sort of that pivotal moment when I knew that I was really sick, which was when there was a day, it was like 4 o'clock in the morning or 5 o'clock in the morning, and I had to, the alarm went off, and I had to go downstairs, let the dogs out. I have 2 dogs, and I let the dogs out, and I was starting to make lunches for the kids. And the ritual in the morning for anyone who has kids would know that it takes like 2 hours for me to get everything organized. I had 3 kids, they had to get to daycare, I had to nurse the baby, change diapers, so many things, plus make lunches and meals and get my pumping equipment and plus my own stuff together. So at 5 o'clock, that's what I would start doing. So I remember that day because I was hobbling down the stairs, but I was taking care of business and taking care of stuff, and I remember that the baby cried, and that day the baby cried, and she's upstairs. I had to get back upstairs because I was worried she was going to wake up my 2 and 4-year-old who didn't need to get up for another hour. So I tried to get up the stairs that day, and I tried to run up the steps, which was a joke. I ended up crawling up the stairs that day, and my husband found me with the baby crying and me crying on the bottom next to the crib because I couldn't even lift the baby out from the crib.
Wow.
Yeah, so it was the day I really knew that things got real very fast. But I still was obstinate. As any good physician does, I checked my own labs, and I didn't go see a doctor. And it's crazy.
Mm-hmm.
And I figured I had Lyme disease. Actually, I take that back. I think I treated myself for Lyme disease first. I treated myself for Lyme disease because I'm super active. I thought, oh, I must have picked up a tick. I lived in a wooded area at the time. I must have picked up a tick. I've got Lyme disease. So I started treating myself for Lyme. But I absolutely wasn't getting better and just continued to get worse. And that's when I started checking my labs. When I got all my labs checked, I just talked to a friend of mine and said, what should I check? Of course, not still seeing a physician. And we went through, and she said, oh, check this. You know, she's an internist, so she said, check these numbers. And I did, and I got all my labs checked, and they were ragingly abnormal. And it's at that moment that I really knew that I had a chronic illness and that I was going to have to start seeing some doctors, and started my path to becoming a patient.
Wow. And so the doctors that you saw, what did they tell you about the illness, and did they even mention diet at all?
Oh, no. So I went to the best medical program with the best team of rheumatologists that I could find, because I knew that I would never accept my diagnosis unless I heard it from somebody like that. I was that stubborn at the time. And so I went to the chief of rheumatology at a big program in Maryland, and I talked to him, and he told me I had advanced rheumatoid arthritis. And he said that my markers were so abnormal that I was prognostically I was going to have a bad prognosis overall if I didn't get started on therapy immediately.
Wow.
So he told me he knew I was nursing, and he told me that I just needed to stop. So he told me to stop nursing the baby within a week, that I needed to get on medicine. Maybe the hardest week of my life. And to take away that choice was painful. The guilt I felt, the crying baby where I had to walk away because I couldn't feed her. Were so many feelings of sadness that you could feel as a mom. And you have to understand, for me, I had 3 miscarriages before I had my kids. Like, I was so happy to have children, and I loved every moment of it, and I still do. I love it. And so I love the nursing, and I love the carrying the baby, and yeah, of course, there's so much that's difficult and exhausting. But I had wanted to have children for so long that I was super excited when I had them. And so for somebody to take away that choice from me was very, very painful. But I did. I stopped nursing, and I got on all these medications within a week. And no conversation about diet, about lifestyle. And they said that I needed to get used to the fact that I would be on medications for the rest of my life.
The rest of your life, wow.
Yes, I remember that conversation. They said, there is no cure for this illness, and so the best thing you can do is just acknowledge and accept that you will be on medicine forever.
And were the medications helpful? What was your quality of life while on
I mean, they work. They work. I definitely was able to move again, and I went back to running, but I had loads of side effects. My hair fell out. I had a metallic taste in my mouth all the time, and it didn't all fall out. I have a lot of hair. But I had bunches of it would just come out, and metallic taste all the time. I never felt like eating. I lost a lot of weight. It was rough. It was rough, but I was better, and I was functional. And as a patient, you learn and that you deal with certain side effects to feel better. And so that's what I have always preached. And so I listened to my own advice.
Right. So then when did you start a plant-based diet, and what led you to make that change?
Remember, I was already vegetarian. I mean, I was the director of my women's program and my prevention area, and I already believed that diet played a role. But I just thought that I had a good diet, and I think that's often the misconception is that people think that their diet is good if they're vegetarian, or if they're vegan even, people think their diet is good. I often tell people I'd rather you eat meat and eat clean rather than eat vegan or vegetarian and eat, French fries and
Oreos
right, exactly. So, exactly right. Like chocolate chip cookies can be vegan, but they also are loaded in refined foods half the time. And it's not that I'm against cookies. It's just that there's a time and a place. And so much of the time in my, even my own father, who I adore, he's vegetarian, and he likes to go to Burger King and get the veggie burger and on the bun and a thing of French fries, a sundae, and a Diet Coke. And so that's vegan. So, it's very, I think a lot of people think they have a good diet. I think a lot of people don't really understand what good diet is. I think it's confusing out there because there's so many diets of people who say that this is good and that's bad, or this is good and, paleo or keto, or, now there's this Gundry coming out saying, actually don't eat lectins, and, we're saying plant-based. Like, what are you supposed to do? And so I think as a person, it's so easy to pick and choose what you want to hear and go from there.
Okay. So what were the big diet changes that you made?
So when I was like, I don't know, 6 or 8 months postpartum now, I was on medicine. Maybe it had been a year. I met a woman who wanted to come to one of my community programs, and she wanted to do some nutrition consulting, and I didn't really have space for another person, so I said, I'm not sure that I have space, and let's plan for next year. And she was like, well, look, why don't I show you what I can do? Let me do your profile. So I sort of said, I don't really need help. I'm good. I'm already vegetarian. And that's when she said, well, look, just let me do it for you. Give me 3 days. And so I humored her maybe, and so I was laughing at, she's still a friend of mine. And I used to tell her that, I'm so glad that she was so persistent, because putting that profile together and her bringing up things that I was eating and saying that they weren't necessarily good, it was the first time I started thinking about the role of what you eat and how it can trigger inflammation in your body. And that is a fundamental concept that people don't understand. I certainly didn't at the time. So I started cutting out refined foods. For me, I think my biggest trigger was dairy. So I had a complete dairy elimination. Remember, I was already vegetarian, so I started adding back loads of anti-inflammatory foods. And within weeks, I was a different person.
Wow. So how did you feel a big change when you eliminated those foods? Were you able to, change your medications?
So within weeks, I felt better. So there was no question that things were better. But how does one know? A scientist would say, how do you know it's not just the meds? And that's true. How do you know that? You don't know. And so for some time, I did both. And I think I went back to that rheumatologist, if I recall, and he said, well, I remember the first thing he did is he checked all my labs, and they were all flat. And he checked my lipids, and he said, your LDL is crazy low. Like, what happened? LDL is the bad cholesterol. And he's like, why is it so low? Did you start a statin? And I was like, no, I really didn't. He's like, no, come on, seriously, you're a cardiologist. I'm sure you started a statin. I said, yeah, honey, I really didn't start a statin. So it's just what I'm eating. But that's sort of where it got left, and him thinking, and, the conversation I kept asking was, feel so good. When would we consider weaning medicine? When would we consider, and a lot of rheumatologists won't consider a wean. And so they think that this is a lifelong illness. And he wouldn't consider it. And there's no disrespect to him. It just was something different than I believed could happen. Because I think if you can trigger gene expression, if you can trigger genes that you are predisposed to having. So, right, if you imagine that everybody comes with a certain set of genes that they are born with, right? It's because of your parents, and you can't change your parents. So you get your own genes. But what then activates that gene? Usually something is a second trigger that activates the gene and then triggers this inflammatory cascade. And so if you can turn on gene expression, then I believe that you should be able to turn off gene expression.
Right.
The question is how. And so if you can turn off gene expression, then you're suggesting that there's a way to cure illnesses that maybe we thought we couldn't cure. And then if there's a way to cure, then there's a way to wean off meds. And that was sort of the fundamental concept I was holding on to. And fortunately, there was no data. There's very, this is even 7 years ago. So much has been written in the last couple of years. But back then, even very little stuff. There's very little now, but then even less. Mm-hmm. So I had trouble working, decided that I needed to find a new rheumatologist that would work with me. And I sort of started a slow wean on my own. Okay. And the medicines they're long acting. They last in your body for a while, so you have to go slow. It took probably 6 months to a year to wean off. Okay. And I remember the specific time I weaned off my meds because I think I took my, I remember specifically because I had ran my first triathlon that month that I had decided that I was done. I was going to be no meds that month. And yes, I did my first triathlon. That was the month.
Wow. I mean, that's amazing, especially with everyone saying you need those medications for the rest of your life.
Yeah, it's hard to hear that. It's hard to take the leap of faith.
Mm-hmm. So you mentioned curing diseases. Do you say that you cured your disease?
No, I don't. Because I don't think that I'm cured. I think I'm treated. Mm-hmm. I don't think I have any active signs or symptoms of rheumatoid. Okay. I don't take any medications, and I haven't been on any medication in 4.5, maybe 5 years now.
Wow. Okay.
And so
no symptoms.
No symptoms.
Okay. Wow.
But if you check my numbers, my inflammatory markers, my measures of inflammation, they're all normal. Okay. But if you look at the measures of gene expression, they're still active. Mm-hmm. So I think that line between gene expression, so I think I still have the illness, or I still have at least the predisposition to the illness, but I don't have any active symptoms.
Okay. There's always talk about if you are predisposed to an illness, does that mean you have that illness for your whole life? Can you ever cure something that you're predisposed to?
Right. So it's a good question, and it's going to be an ongoing question. But I believe that even if you're not cured, if you've caused genes to calm down, stop expressing, then that's as effective as cure is. I mean, I don't think you can ever change your genes, right? I mean, people who have BRCA and are developed a risk for breast cancer, or if you, all of us have so many sets of gene combinations that we don't even understand that trigger whatever illnesses that we are at risk for. And so I don't think that we can't get rid of those genes, but can we prevent them from being expressed, I think, or at least cut the inflammation. But I also am not somebody who doesn't believe in medicine. I think that medicine has an important role. Right. And there's certain things that only medicine can do. For instance, a lot of people contact me and say, I've heard about your story. I want to do what you did. Mm-hmm. I want to come off all my meds. And I'll say, well, is your inflammation under control? Because I think people think that you can just get on a diet and they're just all of a sudden miraculously all your symptoms are going to go away. And I don't think it goes that way. I think you have to calm your inflammation down, and sometimes you'll need medications before you can really suppress the symptoms. And if you wait for dietary change to have help, then you could cause significant damage to your body. So I think it's really important to understand that there's a role for medicine and there's a role for lifestyle. Sometimes they're complementary. Sometimes they work in tandem, though, and eventually you hope that there'll be lifestyle that will be the dominant force. But not everybody will have the same result, because it depends how long you've had the illness, how inflamed you are, and so different people will have different scenarios. Not everybody will have the same outcome that I've had, and maybe some people will have a better outcome or worse. Everybody's very different. Yeah.
No, you bring up a really good point. The end goal is kind of medication-free, good diet, good quality of life, but sometimes we need some time to get there, and we might need medications to help us get there.
There's no shame in taking medications. I'm a doctor. I give out medicine every day.
Right, exactly.
But I'm also proud to take people off them. You know, I have patients in my clinic that come in on 5 medicines, and they say, well, I want to come off my medicine. And I'll say, well, great, that's awesome. I want you to come off. But what are you willing to do to make that happen? And sometimes you'll talk to people and you'll say, well, I want you to do these changes. And they're like, oh, I don't want to do that. I'm like, well, you can't have it both ways. You can't do what you want to do with your lifestyle and sort of eat sort of in this way and not take care of yourself and say, I don't want to take medicines. It doesn't work that way. It's a tandem thing. You have to take the medicine, calm inflammation, add in the lifestyle changes, and then make the lifestyle changes the dominant force.
Okay, that makes sense. And so also I'm wondering, a lot of people are confused on how diet could possibly have a role in an autoimmune disease, like arthritis. What is the major role? Is it just inflammation, or is there...
Yeah, it's inflammation via gut biome. I mean, a perfect example of that is celiac disease. And so for anybody who doesn't understand the concept of, or that connection, a case in point is perfectly a celiac disease, which is an allergy to gluten, right? And this is not the same thing, to be clear, as a sensitivity to gluten, which is not an allergy. So people who have gluten allergy, that means they have celiac disease. And so when those people who eat wheat or wheat products, and they eat those foods, they cause a leaky gut. Their microbiome, their gut flora changes. Their gut, it's called a leaky gut, where the junctions between the intestinal cells, actually the intestine being the gut cells pull apart, and toxins can enter into the bloodstream, and that triggers inflammation. If you have extended amounts of intake of wheat in a celiac patient, those junctions stay open, inflammation continues to be high, and that person doesn't just develop diarrhea. That person gets a systemic problem, right? They get headaches, they can have seizures, they get joint pain, they get abdominal pain, they can get skin rashes. So it's just a proof of concept, which is that what you eat can then trigger via the gut biome, can trigger inflammation, which can then trigger a systemic illness. Why some person gets gets type 1 diabetes, or one gets rheumatoid, and one gets lupus, and other people have different heart disease or rupture of heart plaque, is because everybody has different protoplasm, different gene makeup, and different history.
Okay. So kind of what you eat can trigger inflammation in the gut, and that might have a different effect on different people, causing a different disease. Okay.
Absolutely.
Okay, that makes a lot of sense. So aside from diet, I know we're talking about diet here, but were there any other lifestyle changes that you made?
Yeah, I did yoga 3-4 times a week. I started meditating, and I started sleeping. And I actually started, I cut back on exercise, actually.
Oh, really?
And, I'm a huge exercise advocate, but there's a balance in life that some of us have trouble achieving. And sometimes stepping back and allowing yourself time to heal is also okay. So I cut back on a little bit of exercise. I did a lot of yoga. I did a lot of meditation. I slept a lot, and I was meticulous about my diet.
Okay. So I just want to get, for the viewers, the top recommendations for somebody who has arthritis, wants to feel better, and kind of move towards getting off their medications. Like, what is the best way to get started?
So it's not... Often it's not just one thing. And, sometimes I make people a chart of inflammation, and I write down triggers, and I'll say, well, people don't realize that there's 10, 11 triggers for inflammation. And then I look at that person, and I say, these are the triggers that I think are your problem. Okay. And so a person should do that. A person should look if their activity level is too high or too low, if their stress levels are very high, if they're not eating well, if they're exposed to a lot of noise, air pollution. All of these things are different triggers for inflammation. And so after you sort of look at that list, and a lot of those are in my book, I think they're in the book, where we talk about the different triggers that you have. And so you got to sort of look at that line, and you got to see which one of the ones you have. And then you got to target those things. When it comes to diet, that's most people's problem, is that's an easy, quote unquote, easy one to fix, in the sense that if, you can see you can see an impact within just weeks. So I think that cutting out refined sugars makes a huge difference for every illness.
Okay.
I think that cutting out dairy is a huge inflammatory trigger.
Okay.
I think that fake sugars like Splenda and stevia and all that artificial stuff is also a significant trigger for inflammation. You have to add back in loads of antioxidant foods, so loads of fruits and vegetables. You should be eating kale and spinach. And people ask, well, what kind of greens should I eat? And I hear that a lot. Well, people say, oh, I like greens, but what kind of greens do you eat? Oh, green beans, corn, lettuce. And I was like, what kind of lettuce? Iceberg? I'm like, oh yeah, I like iceberg lettuce. I'm like, no, that's not real lettuce. So like, you got to eat foods that are green, and you got to realize that there's different benefits from every vegetable. The greener the vegetables, the better, because those are the ones that have the nitric oxide, which are the ones that dilate blood vessels, and those are the ones that are full of anthocyanins, which are those plant nutrients that are really good for everything, and plus the fiber, which is its own benefit. So you got to eat loads and loads of fruits and vegetables. It's 5, 6, 7 servings of fruits and vegetables every single day. That's actually an ACC/AHA guideline. Meaning ACC is our cardiology guideline, where we recommend 5 to 7 servings of fruits and vegetables every day. People have a lot of trouble understanding how to do that. Well, if you're eating 5, 6, 7 times a day, eating 5 to 7 servings of fruits and vegetables is very easy.
Right. And what about the whole fat debate? Oils, avocados, nuts, does that affect the inflammation at all?
Different people, different things.
Okay.
I have some people that have what we call familial hypercholesterolemia. So your LDL when you're born is 40. When most people in America are somewhere between, when they're over their life, they're at between 100 and, I don't know, maybe 200, which is very high. But you should be sort of under 190, 100 to 190, let's say. I have a patient whose LDL is 300, and he's had that LDL that high his whole life. That's a genetic predisposition. So he's a person that when he and I met, I didn't give him many options to add a lot of fat in his diet. I significantly he had to make significant and drastic changes. Now he's also on medication, but with the combination is necessary for him in order to get his LDL down. So, Essie's a good friend of mine. We all have different opinions about avocados versus nuts versus what should you do. I think it depends on the person. And so some people I allow them to have nuts, some people I don't. I don't think that fat is a negative per se. If you're eating those sort of good polyunsaturated fats, they're nourishing, they fill your tummy. But if you have advanced heart disease, I may not let you have those things, at least at the beginning.
So very individualized.
Yeah, definitely.
Okay. So have you had a lot of success in your prevention clinic with changing the diet?
Oh yeah, it's awesome. People always say, oh, you're in the South, you're not going to see that kind of impact. I think people underestimate the South. I think people are pretty awesome and they're willing to make the change. And some people will say, I'm a meat and potatoes kind of guy. And I say, well, your days of meat and potatoes are over. And so they look at me like, huh. And often I'll tell them, like, look, you have a choice. You have to think about how much this is worth.
Right.
And how much is it worth to you to eat that steak once or twice a week? How much is it worth to you? I'm offering you a life where you can be free of a future heart attack. Because remember, a lot of people who come to see me have stents in their heart, or have had bypass surgery, or at risk for those things, or diabetics. And so these are the people I see on every day. And so I'll say, well, how much is it worth eating those cookies at night, or eating that bread that you love, or the steak that you love? Because I would argue that I can offer you an opportunity to come off medicine, to not come into the cath lab and need to have another stent. And it's interesting, people will change. I mean, they change. And I have patients that are 300-400 pounds that are 200 pounds now, or I have patients who are come in raging diabetics and are no longer diabetics. I have people who are on 5 blood pressure medications when they come in, and 6 months later they're on none. One of my favorite stories is a woman who's young, and she has a heart pump in because she has a weak heart, and she needs a heart transplant. But she couldn't have a heart transplant because she was too overweight. And she came to see me, and she was laying in bed 18 hours a day, and she looked like she felt unhappy, and she had a 9-year-old boy who she didn't cook for, and she had this amazing husband who fed her 3 meals a day in bed, took care of her son, took care of everything, because nobody wanted. She knew she was sick, and she had trauma from the surgery, plus she was depressed, plus so many things. We worked together for 6 months. She came in on a walker the first time she saw me. By the end, she had lost, 12, 15 pounds. She looked amazing. She was put makeup on and earrings on, and she had she felt that she was cooking for her son. She was active every day. She was going shopping. She was hanging out with her friends. And the best thing, she came in the last time I remember seeing her, she goes, "Doc, guess what? Don't you see?" And I was like, "Wait, what don't I see?" And she's like, "My walker." She was no longer using a walker. Didn't even need a cane. It was amazing. I mean, it's amazing. And so, in my clinic, people come in and they have an hour with me. We have an hour visit. And some people, we meditate. And some people, I give them exercises and I make them do them. And I'll sit there and watch them do them and teach them how to do them. And some people, I'll pull yoga mats out and I'll give them some yoga stuff. Like, everybody needs something very different and come to me for very different things.
That sounds amazing.
It's fun. Yeah. It's definitely a fun clinic.
So why do you think so many doctors aren't doing these things, aren't talking to their patients about diet? Is it that they don't know about it? There's not enough literature on it? What's the deal?
There's many things. The two big things are most doctors aren't trained in it.
Okay.
We don't get any training in medical school, or very little. And then when you go out, you get less and less training because there's not a lot of sort of continuing medical education. And then there's no time. Because the demands in your clinic are to see often patients every 15 minutes, which is a significant issue with our healthcare system.
Right, and you spend an hour, you said.
I do.
So you get a lot of time. Wow. Well, thank you so much for sharing your story, all of this information. Thank you for being on my channel.
Sure.
And really just fighting to help others live healthier lives through
it's
nutrition.
My pleasure. Thank you.
Yeah.
It's a joint mission. We all have to work on this together. And every time that I publish something, I'm publishing something for the team, for the group, because I think that we need to get the word out to as many people that there's benefits. We need to talk about our stories. We got to publish the data that shows that it works. And I'm so invested because I feel if I don't figure out and understand the links and teach people these links, then what happened to me maybe was just random. Maybe it was just a random thing that happened. Like, I need to prove to myself that I got better because of real science, like something really changed. And so as I do this with other people and other patients, and they're seeing and the data is getting published over and over again, that becomes the data that sort of becomes the future foundation for other doctors to say, hey, look, this works. We got to do this.
So you're doing research now on plant-based
all the
diets?
Time.
Okay.
Oh, yeah.
On what kind of clinical trials with?
So that's why I came to University of Florida, to educate physicians. So I teach medical students, residents, fellows how to educate others on nutrition by teaching them about nutrition and lifestyle. I run that prevention clinic, and I do a lot of research. So asking the questions about why different things work. What kind of patterns do people follow? What kind of compliance rates can you achieve with putting people through different types of lifestyle changes? Will they be compliant over a long time? One of the best things we've done is we have a new plant-based menu in the hospital. So, like, all of our patients who walk in the door are offered a plant-based menu. So everything's 100% plant-based. So cool. And so it's so cool, right? So, and so some of my patients, it's so funny, because patients have been complaining when they don't, before we received it, there was a time in the transition time before when we just started the menu where people had heard about what we were doing and were like, why didn't we get that menu? And I would have to send an email like, look, people are asking for this. Get the menu. Get them the menu. So it would make me crazy. But now it's sort of mainstream. Everybody gets that menu. Everything on it is plant-based, down to the milk for your tea. And so that's awesome. And so imagine a patient who walks in the door has a very different experience when you come to the University of Florida. In the past, it was like, sir, you've had a heart attack. We put a stent in your heart. Here are your medicines. We'll see you in clinic. Now the scenario is, hey, listen, you've had a heart attack. It's okay. We're going to get you through this. We want you to eat off this menu. We want you to learn, watch these movies. We want you to do this education. And then we want to see you in our clinic, and we're going to teach you more and more and reinforce it. And think about how many, your hope level is higher. You're more motivated. Those are extreme teachable moments. And so you have to remember that if depression and sadness are some of the worst feelings you have after being diagnosed with a chronic illness. I certainly felt that. I always tell people that one of my hardest moments was being in the wheelchair, being put into a wheelchair and I remember they put me in a really large chair because they didn't have a little one, a regular size one. And so I remember how the smallness I felt being in that massive chair. And so I think people don't realize how much sadness comes from chronic illness. And if you give people hope and motivate them, you can change everything.
Wow, that's so powerful. It's so amazing to hear everything that you're doing. It makes me so happy.
Hey, it's me too. I mean, it's fun stuff. There's no question. And my kids are. It's cool. My kids are little and they listen and watch and see what's happening, and they talk to. My daughter. My middle daughter is the teachers are all telling me that when anybody hurts any of the bugs at school, she's the one saying, "Stop hurting the bugs!" And she picks them all up and scoops them into the grass. I mean, they're watching, they're seeing the importance of protecting the animals and for eating healthy, and they see it and they know. I always tell a story when my boy was little. He's now 11, but when he was younger, he said, "Mama, I don't want to eat kale." And I'd say, "Honey, I love you, but I don't care." And so, because he kind of, it sounds cold, but it's not, because I want them to eat those foods. And so now they eat those foods regularly, and it's sort of a non-issue. And so, it's fun. It's fun raising kids this way and teaching them, seeing them then tell other people about nutrition, and I'm listening to my words and come out of their mouth, and it's like, oh my God, they're amazing.
And so young.
Yeah, it's so cool. Oh, wow. It's really, it's neat to see. So, it's all good. We're all working towards a common mission. I think as much as we get the word out, people will change.
Yeah. Wow. Well, that's all my questions for today. Thank you again so much for doing this.
My pleasure.
Good. Yeah. And for the audience, I will have links to her website and her book down below in the description box. Thank you everyone for watching Vegan with Jenn.